And in Work Package 8, we had to do some specific tasks that were to improve the work access and participation of people, to support employees in implementing life promotion and chronic disease prevention, and to reinforce decision makers' ability. And this is why we're here. We are trying to present the tool we developed to reinforce this community and to reach these aims. This is what we produced after the first 2 years of work. We produced, we call it Toolbox, that is composed of 2 instruments. The first of the 2 I'm presenting, the second will be presented by Jaana and Eeva. And the idea is that we are trying to create a common language where employment gets into health, and health is in all sectors, so that there is a synergy between the different areas. And the final aim of our work was in fact to increase work participation. That was the main aim. Starting from us in the training tool, we have been thinking when people develop a disease while they're working, what happens to the managers and what do they do? And the other is what can be done to prevent it. And the training tool has been developed with this aim, with the aim to support managers when a person that is already working develops a chronic disease. What do they do? What can be done? Are there things that can be done? And how can we support managers? Because previous studies show us that if you don't train managers, nothing will really work. So the main target for any action, if you want to change things in the employment sector, is managers. And the training tool is composed of an introduction that is setting the scene, because many people have no idea that 1 out of 4 of their workers is having a chronic disease, and that is something that is unknown. So creating the culture was number 1 of the aim. The second, we presented 3 things, that is measuring inclusiveness, assessing workability, and having some suggestions to do a work plan. And the last is some examples. So the training has been developed in setting the scene. As I said, this is really something that is really unknown. And it is something that goes out of the things, and many times when we discuss with people with chronic disease, they say either people enter into the disability scheme, that is something that is usually regulated by law in many countries. Many things are unknown and are not measured, and this is something that is going to impact very much. And also some of the countries participating in the joint action, they don't have any kind of legislation that is going to create the facilitation for staying at work. And the training has been directed mostly, as we said, to managers. And why this? Because a good manager is able to change the whole atmosphere inside the workplace. And there are some benefits for doing this, because having people with chronic condition in the workplace, it's something that in previous studies, in pathways and other international studies, is creating some issues. First of all, issues to employers, that having people with chronic disease as perceived as having people that have less production or are less productive or creating problems inside and making expenditure because of their absence. Equally, for the colleagues, sometimes the complaint is that they have to work for the colleagues. For example, if you have a colleague with chronic migraine, you're doing 1 day of absence per week. That is something that will not enter into special scheme, but it's going to affect the environment. And equally, for the people who are suffering, the lack of knowledge is creating a lot of stigma. So the expected benefits for having a training that is managed is mostly to fight discrimination and promote inclusiveness. And this is the promotion of inclusiveness. It is the section 1, and it is the most important one on which we work, because the idea is the inclusiveness of a work setting is not only for the special group that is in a box, the disabled, the chronic, or the women or other groups, but if you have an inclusive environment, that will be inclusive for everyone who has any kind of issue. And the inclusiveness theme is going to be developed in something that has been newly developed and is actually tested in different countries. That is the checklist for inclusiveness. It is 4 sections: work environment and enterprise, reasonable accommodation, management and teamwork. Each of them has 10 yes and no questions to which each manager can reply to see whether you have this or not. And then the final scoring of this will be 40 if you have everything in these 4 areas. Or you can have a lower score according to the different things that are lacking. This allows immediately to understand whether your environment is inclusive or not. and immediately allows you to find where you can intervene to increase the inclusiveness of your working environment. This is something that shows to be quite useful, particularly in the way we are administering it. You give it to managers, they score what they think, or you also give to the different department of a working environment, and you then compare the scoring, whether the people that work in that area, they feel that it is inclusive of the environment in which they work. And you can compare this, you can do some very targeted actions. The second thing that we are teaching is workability, testing workability, meaning whether the environment in which people work is able to make everybody to work. And assessing workability, the instrument was not developed on purpose, this has been developed in Finland, but we are suggesting that it is used, widely used in the enterprises, to measure the ability of the employment sector to adapt to people. And the third, responding to the challenge, we ask people that once you have tested the inclusiveness and the workability of your people, you prepare an action plan. And to do this, you need to tackle three things. How you maintain, you first develop the action plan, and you try to increase inclusiveness. Second, you try to maintain people at work. Third is to have possibility to return to work policies that allow people to come back to work after long absence due to a disease. And the fourth is how you do reasonable accommodation, which is usually most related to flexi time. We just conclude our training with presentation of some of the key most burdensome areas of disease, that is usually musculoskeletal, mental and neurological, cardiovascular, metabolic, and these are the most common chronic conditions that you can find in the workplace, and we describe them, describing what are they and what can be done for the specific disease. So at the end, all profession, all work, all activity in the human world finds it is essential, meaning in the story of each person. That's the point. We are preparing something that is for everybody, but I think that we have been working for each citizen that is affected by chronic disease. And I think while we're piloting it, and I really thank all the partners for doing it, we are testing and translating Italian, French, German, Hungarian, and Lithuanian, and we are testing it in different settings and in different enterprise. It will be ready by February next year, together with the toolkit. And in saying this, I'm giving the floor to my colleagues that are going to speak from the second part of the toolbox, that is Jaana, Lindstrom, and Eeva, and thank you very much.
Why would we need this kind of toolkit for workplaces? So we have been talking about, Matilde explained to you about the burden of chronic diseases in the working life. But we know that many chronic diseases have their origins in lifestyles. And lifestyles are shaped to a very large extent by the environments we live in. And thinking about the environments we live in, what is one of the most important environments that most of us spend our time in? It's the workplace. And therefore, workplace could and should be an important setting for promoting the health and well-being, especially of working age population. And a specific burden is to these workplaces that work in shifts. So it's known from research that shift work is predisposing to many chronic diseases and risk factors. And shift work is not something very insignificant. Up to 20% of European workforce are working in shifts. So therefore, especially shift working places should pay attention to the working environments. There is also some hard evidence to show why healthy lifestyles should be taken into account in working life. So these are data from 13 European countries, and they are showing how being obese, whether not being versus not being obese, or being a smoker versus not being a smoker, or being a heavy user of alcohol versus not they all have a significant effect on the employment rate, and this was only after 2 years follow-up time, so the effects can come really fast. So why should these employers then invest in employees' well-being, health and work participation? So there are quite evident benefits for the employees. So the well-being and health increases, workability increases, even income may increase. But also the general work satisfaction and life satisfaction increases. But there are also certain benefits for the employees that they should consider. So reducing absenteeism and reducing occupational healthcare costs, reducing staff turnover, they all add up to increasing productivity. And now that we are moving to an era where companies are actually competing for the workforce, so the image as a responsible and caring employer might also be an important factor. And finally, there are these societal effects, so sustainability and equity, and population health increases, and healthcare spending decreases also. And these are all the effects that can be achieved by changing the working environments. So the toolkit for workplaces, which is entitled Fostering Employees' Wellbeing, Health and Work Participation. So it's the deliverable of the Chrodis Plus package 8. And it includes means for workplaces to support the well-being and health and enhance work participation of all employees. So I want to emphasize this because this is not something targeted for people with chronic diseases, but it's for everybody. So it's kind of actually reducing the stigma related to chronic diseases. The toolkit is meant to be used by everyone involved in fostering occupational well-being and health, so the management in the workplaces. It's based on 3 systematic literature reviews and 45 stakeholder interviews conducted in 6 European countries. And at the moment we have it in a PDF document format, but we are also considering how we could make it a more usable web-based version for easier use by the employers. And now my colleague Eeva will continue about the actual contents of this toolkit.
Right, so the toolkit is constructed of 7 domains, each of which are important to the overall well-being and health of employees, and each of which the workplace and the employer has the possibility to advance. These domains are nutrition, physical activity, ergonomics, mental well-being and health, recovery from work, community spirit and atmosphere, and smoking cessation and reduction of excess alcohol consumption. Under each of these 7 domains, we have collected 4 various types of approaches that can be adopted to foster the well-being and health of the workplace or the employees of the workplace within any of these domains. And the approaches aim at strengthening employees' knowledge and skills to take care of themselves. They aim at providing tools to create well-being supporting social and physical working environments. They aim at fostering the adoption of well-being enhancing policies, practices on an organizational level, and they provide incentives or suggestions for various kinds of incentives that might then prompt employees, means that a workplace can put into practice in order to achieve an improvement in any of these domains. Many of these concrete needs are such that they can be put into practice without massive investments, whether regarding time, personnel, or monetary investments. And therefore, the idea being that these could be adopted, or at least some of the concrete needs in the toolkit could be put into practice also in workplaces that do not have resources to invest a lot of money, time, or personal workforce to put these needs into practice. The toolkit can be used both as a checklist and an idea creator. Checklist meaning that a workplace can browse through the content of the toolkit and map which of its domains have already been paid attention to at the workplace, which of its approaches and concrete needs have already been put into practice and already are in use at the workplace. And this is to make it visible for the workplaces that there may already be things that they do well and that they should keep maintaining. Then on the other hand, it may make it visible to the workplaces that which domains could still be focused on to better support employees and their well-being, health, and work participation. The toolkit also provides help for the workplace to plan the actual implementation of the means that are chosen then to be put into practice at the workplace, and how to tailor the suggestions that the toolkit provides to meet the resources and needs of that particular workplace, so that the mean fits the resources and needs of the workplace and its employees. Just to give a couple of examples of what these concrete needs then could be. Nutrition could be enhanced, for instance, by improving the variety of healthy alternatives available at the workplace, be it in the workplace cafeteria or a vending machine. Physical activity could be enhanced by adopting various technologies that automatically prompt and remind employees to stand up, take a couple of steps, take a micro break for physical activity within performing daily work tasks. Ergonomics could be improved, for instance, through providing employees training on how to adopt or perform work ergonomically. For instance, through a healthy working posture, safe lifting technique, or how to adjust available tools and appliances so that they can be used in a health and safe manner. Mental health and well-being could be, for instance, fostered through reflecting together, both employees and the management of the workplace, on how each individual at the workplace could, through own behavior, promote inclusive, supportive and respectful working climate, organizational climate at the workplace. Everything starts, for instance, by remembering to thank colleagues for the help they have provided, or by acknowledging colleagues for the good job that they have done. Recovery from work can be fostered, for instance, through various flexible work arrangements. Community spirit and atmosphere fostered, for instance, through arranging minor collective social events such as common coffee breaks. And the smoking and alcohol domain could be promoted, for instance, through adopting non-smoking and no-alcohol policies at the workplace and outside the buildings of the workplace. Currently, this toolkit has been translated into altogether 7 languages: English, Finnish, Dutch, German, Italian, Spanish, and Lithuanian. We are currently piloting its utility and usability in 6 European countries, and together with the training tool, our toolkit, the final version, should be ready by the end of February 2020. And after that, it could be shared freely. Yes. And now the question is, how could EU policy support the implementation of these 2 tools that we have been working on? Thank you.